So bottom line is wounds heal more rapidly, inflammation is reduced quickly, tissues repair themselves, even when those tissues have almost zero oxygen or nutrient supply, like cartilage, tendons, and spinal discs. That's just in a nutshell of what we've already seen, right? And so, a couple more things, just the CNS is the central nervous system, so the effects on the brain. It increases ATP in the brain, decreases nociceptive neurotransmitters. Nociceptive means pain, so basically it decreases pain perception by the brain. So I just wanted to drive that point home because that's kind of a big deal. Increased natural analgesics in the body and a reduction in global pain in the body. Here's the study, one study, 2016 again. Transcranial, so that means through the head. Transcranial low-level laser therapy at 810 nanometers, which is built right into the whole body pod and also built into the handheld. It temporarily inhibits peripheral nociception, that's pain reception. So here's what they said. Photobiomodulation or low-level light therapy has been shown to attenuate both acute and chronic pain, but the mechanism is not well understood. In most cases, the light is applied to the painful area, but in the present study, we applied the light to the head. This was the first study to show that inhibition of peripheral pain due to photobiomodulation of the central nervous system. So instead of people have, like you can have pain in your other joints, in your feet, knees, anywhere, and without even treating that region, they just did it right through the head, and it reduced pain in the whole body. So that's another beauty of the pod. Your head's in there, right? So you're getting the actual areas that need treatment. We can spot treat with a handheld with high concentration dose, penetrate to deeper tissues, even bone, and then we can put people in the pod, and then you also get the transcranial component too. It's a pretty awesome thing. Like, it's a really powerful thing. So I just wanted you to see that it's actually in the published literature. By the way, PubMed.gov, that's the National Library of Medicine and the National Institutes of Health. So these are peer-reviewed journals. This isn't gleaned from Men's Health, Reader's Digest. These are major journals, right? And so Orthopedic Rheumatology Journal 2015, use of low-level laser for musculoskeletal pain. Pain is the most common reason for a physician consultation in the United States. 1 out of 3 Americans affected by chronic pain annually. The #1 reason for missed work or school days is pain in the musculoskeletal system, muscle and joint. Currently accepted therapies consist of non-steroidal anti-inflammatory drugs, steroid injections, opiate pain medications, which is working out really well, right? And surgery, each of which carries their own specific risk profile. What is needed are effective treatments for pain which have acceptably low risk. For over 40 years, low-level laser therapy from LED and low-level light, also known as photobiomodulation, has been shown to reduce inflammation and swelling, induce analgesia, pain relief, and promote healing in a range of musculoskeletal pathologies. The acceptance of PBM, which is currently being used by many specialties around the world, into the armamentarium of the American healthcare provider would allow for additional treatment options for patients. A new cost-effective therapy for pain could elevate quality of life while reducing financial strains. It says it all.